Welcome to the Enlightened Pet Behavior Podcast. I'm your host, Susan Light. In a world overflowing with conflicting advice and often misguided information, my mission is to be your trusted source for accurate, kind, and truly effective strategies to understand and shape your pet's behavior. Join me as we shed light on common challenges and work to foster a deeper, more harmonious bond with our beloved furry family members. If you find the show helpful and enjoyable, please consider showing your support. Subscribing, following, rating, reviewing, and sharing with your friends takes just a moment, but significantly boosts the show's visibility, helping more pet parents discover it. Thank you for your support. Let's get into it. Today, we're busting some common myths about pet health. My guest earned his Doctor of Veterinary Medicine from Midwestern University in 2020. He is a first-generation American, completed a small animal rotating internship, followed by a residency in small animal internal medicine at Michigan State University, achieving board certification by the American College of Veterinary Internal Medicine in 2024. In addition to practicing internal medicine, he is passionate about education. He regularly teaches veterinarians and veterinary students while also creating evidence based educational content for pet owners through his social media platform, which we will link in the show notes. His work focuses on translating complex medical concepts into practical, accessible information and challenging commonly held misconceptions in veterinary medicine. Please welcome Dr. Andy Ogrodny. Well, welcome to the podcast.
Well, thank you so much for having me.
I'm super excited. So, I saw a post of yours a while ago about all these myths, and they really reverberated with me. And I thought it would be great to talk about them today with my audience.
I'm really excited to honestly have the opportunity to talk to your audience because a lot of people don't know veterinary specialty medicine even exists. And then we talk about common myths in pet care and pet observations where every day in my day to day, I see these cases where people feel like they are being brushed off or don't really acknowledge these behaviors in dogs where we assume an animal is picky because they're picky, which of course everybody has their preferences, right? But usually signals there may be underlying disease or is an animal being dramatic when in reality they're giving us signs through their behavior that something is going wrong. And I'm hoping to help inform a wider audience with that too.
Yeah, well, let's come back to the dramatic because I definitely want to talk about that. But let's start with that picky eating because I hear that all the time like, oh, they're so picky, they never want to eat it. Or I'll show up and they'll be like, they don't really like treats.
Mhm.
So let's talk about that myth.
That is super weird to me, honestly. And the number of dogs that I've seen where owners come in saying, well, they don't really like treats or they've never really been food motivated. And it's a 3-year-old Labrador in front of me, which to me automatically raises some flags that this is the dog that we assume will eat everything under the sun. And suddenly we're not interested in food. A picky behavior or a picky eater in a dog can really signal so many different things. And I have the same conversation multiple times a week with a lot of my owners where this could be a problem outside the GI tract. So things like liver disease or kidney disease or endocrine disease. And we rule all these things out through a diagnostic evaluation. And then we really do focus in on gut disease, which as a veterinary internist, I have a lot of special interests in internal diseases, but those are things that we really under recognize where a lot of people jump to saying, well, vomiting and diarrhea are what we think of when there's a gut problem, when in reality, changes in eating pattern or interest in food, especially when we've eaten the same thing or treats forever, when we have to add toppers to make food really enticing, those are all flags that maybe something is not settling right or our pet is waiting until they're absolutely ravenous and they have to eat something and they will, not necessarily because they want to, but because they have to out of survival.
So to be clear, normal is I put down your dinner and you eat it all.
Correct. Or, graze throughout the day, or, again, it's very dependent on each individual pet because they are their own little person at the end of it all. But it's more if I have a dog that goes from eating their meal every time and suddenly we're only finishing 20 or 30% of it, that tells me there's something going on and we need to take a closer look, especially if it's a persistent pattern.
Okay. And what if someone's like, no, they've always been this way as long as I remember? Is it something where, because they're always like, how do I get them to eat? And if that, what should they be asking their vet if they feel like they came that way?
So even if they come that way out of the box, I feel like everybody will look at standard poodles, and I am safe to assume they're probably picky because they're poodles, but it's rather, hey, is there anything else going on? Or maybe I've noticed if I provide this type of food, we don't really seem very interested, or we notice a case of the bubble guts. And really, the big thing that I encourage owners, especially even new dog owners or seasoned dog owners or cat owners too, is keep a log of foods that you've tried with your pet, because that timeline, especially when you see me, can be so invaluable. Because I think a lot of people come in saying, well, we've tried 6 or 7 different over the counter diets, but that timeline can really dramatically differ between it because not all dog foods are created equally. And that's something you don't need a extensive nutrition background or a PhD to know the difference, but not everything is the same. And some dogs do better with more fiber, or some do more with higher fat content. It really is tailoring that individual medicine to that patient. And that's what's so cool about it is owners are able to tell me, well, yeah, I assume he has a chicken allergy because of XYZ, but that detailed log can really save a lot of detective work when you're sitting down with your family vet, or especially if you get referred to a specialist.
Mhm. That's such a good point. It's such a great tip that people should take because I feel like we're really bad at one, noticing and two, remembering.
Hmm.
So just coming in with this general, like, oh, he doesn't like to eat. We've tried a bunch of things. I can see how that's not as helpful as, we tried this Royal Canin for 3 weeks and, this happened. And yeah, makes
And
sense.
it's so helpful. I love when people come with spreadsheets of their own notebooks because it makes my job easier because then I don't have to be like, what happened in 2016 again? You want to go over that with me? But rather, those observations are so helpful, or even just taking photos of what they do, their bowel movements. I've seen far too many poop pictures in my career that I open up my email. I have like 6 or 7 there waiting for me first thing in the morning. And sometimes I want to throw confetti because we have our first normal poop ever. But those are things that are really helpful for me on the specialty side. Um, Especially animals, they don't necessarily have to show even disinterest, but if they're doing weird things like burping, or they seem really bloated, or sometimes they just seem like they can't get comfortable after a meal, those are all things that scream there's a GI tract problem in front of me. And those are things that I think historically we've really accredited to, well, they're just full and they feel a little uncomfortable, or maybe things just
Is burping not normal? Because I've definitely had dogs burp on my face when I'm, like, loving on them. 'Em. They're like, "Eh." I'm like, "Oh, okay.
Mhm.
Not normal?"
No, not really normal for the most
Oh.
part.
Okay. Good to know, good to know.
Yeah.
Speaking of, let's go back to being dramatic because I hear this a lot and they're always like they're pretending to limp for sympathy or they're just being dramatic, so I'll do this, or they're mad at me, so they're doing this. What do you think about that?
So I think it really is more perceiving that behavior as a physiologic or a real time mechanism to compensate to something. And I can't tell you the number of times I've had dogs come into me where sometimes they limp on a leg, or sometimes they're running a little fever, and we just chalk it up to, well, they're being dramatic. But in reality, they may have a raging autoimmune disease of the joints, or underlying orthopedic disease, or I've even seen dogs that have a smoldering fire in their spinal cord because their immune system's attacking it. And it's brushed off as them being dramatic. And it leads to this giant diagnostic evaluation where at the end of this journey, those owners look back and say, oh my God, was I missing this the whole time? And I really like to tell owners it's not that we're missing it, but rather we're recognizing something that we had perceived as our normal because it's always been there. And we didn't give it a second thought until something finally blew up in front of us.
Yeah. I think part rolling that into that is the like they're peeing on my bed or they're peeing in the house to get back at me or because they're upset, like, that I went on vacation or something.
Mhm.
Um, that's just I think when we put too many human manipulation motivations on
Mhm.
our animals, they're a little simpler than that.
Yeah, well, don't get me wrong, cats know how to manipulate my emotions to get breakfast an hour early in the mornings, but rather, maybe something as simple as, well, maybe the litter box wasn't clean enough, or maybe it actually physically hurts to get in there and I'm giving you a sign, I can't use it. I've caught patients that have bladder tumors because they're peeing outside, and it's one of those things that you don't know until you take a look. And that's what's so challenging and so honestly unique about animals is we're learning each other's language to be able to communicate. And rather just brushing it off or saying it's normal, again, it goes back to they're showing me something different outside their pattern of behavior. And again, something is going wrong. They just can't tell us.
Yeah. And I always tell people when they're like, "Oh, they're just, upset." And I said, "Well, imagine how upset you'd have to be to do that, you know?"
Mm.
So, even if it is stress or anxiety, it's something that can be addressed. It's not something where you're just like, "Oh, he's a jerk."
Exactly. I have a bad day at work. You're not going to catch me peeing in my office.
Uh, so speaking of other bodily fluids, what about cats throwing up? Because I have 2 cats, and I definitely had the impression that them throwing up is, like, totally just something that cats do.
I think that is the greatest myth of all time, and honestly, we should sell that as propaganda that cats vomiting is normal because in reality, if I were vomiting once a week or once a month, I probably would talk to my own physician and say, something isn't quite right. And cats, sure, they can bring up a hairball every once in a blue moon, but you're saying once a week or once a month or every other day, those are things that tell me something is not agreeing to them. And cats are very obvious at hiding diseases up until something has gone catastrophically wrong. We kind of joke that cats will coast along with almost basically no red blood cells or something. And then all of a sudden they just feel kind of punky and then they come in and then something catastrophically is wrong. That is the MO of every single cat patient. But those little signs are them showing that something is unmasking itself. So even periodic puking in cats is abnormal, in my opinion. More than once a quarter is more than a fluke. There is something going on. And sometimes even lab work won't show you that. Sometimes a physical exam won't show you that. And that's where really when I approach the vomiting cat, the first thing that I ask my owners is, well, what have we tried? And even what is the age of the cat? Young cats are more likely to have some sort of food allergy, whereas older cats are a lot more likely to have some sort of acquired disease. So, has their immune system freaked out because they've developed an inflammatory bowel disease, or have they developed a low grade form of cancer, which, even if it is cancer, has a very similar treatment and prognosis to IBD? And those are things where a lot of people come into me really looking back at it and saying, oh my gosh, well, it was there the whole time. And I thought vomiting was normal.
Yeah, completely. And I feel it's so interesting that you said that about cats because that I really do feel like most people are like, the cat is fine until basically they're dying, and you like, dude, and they're like, I mean, that's what happened to my first cat because we had 13 great years, and then he got cancer and he was gone 2 weeks later.
Mhm.
He may have had cancer for longer and missed all those subtle signs. So now it's like the other 2 cats, they're getting their stuff. But, yeah, it's a myth that hurts the animals, I think, for sure.
Yeah.
They're
Yeah.
so stoic. They really do hide it until it's really severely.
And I don't know, Susan, if you've ever seen like the feline grimace scale. That's a pain metric we actually use in modern. Well, I'm glad that you're aware of it, but I mean, it is so hard even for somebody who has experience like me, where I try to be very mindful of my patient's management. But cats don't show facial emotions the same way people do, and it's because they don't really have the
Even
famous
dogs.
or even dogs. Dogs have their own unique signaling system, which to me it blows my mind that a species has evolved alongside us to show us emotions or at least be able to convey those, even though they're not as what we perceive as complicated as ours.
Yeah. No, I'm glad you mentioned that. So for people who've never heard of the cat grimace tale, so for everybody that has a cat, um, and it's very subtle. So like dog body language, I'm talking about all the time, canine body language, to try to understand, when our dogs are stressed, uncomfortable, potentially in pain, these things that we're missing. The cat grimace scale is very subtle. It's like, what is it? Is it 1, 2, 3 or zero?
One of the
Which is a very small scale.
six, 4 or 6. It's been a little while
Yeah.
since I've actually had to study it
But it's like,
in depth.
where are the whiskers? Where are the
Mm.
ears? These really subtle things that, like you said, even for professionals, sometimes you have to take a picture and really look at it and maybe even compare it on the scale because it's subtle.
And cats do such weird things with pain. I mean, they'll kind of scrunch their jaw, or teeth grinding is one that a lot of people don't recognize, but it seems like they're grinding their teeth or getting really raw cheeks because they're biting down on them. Sometimes we'll do things as simple as over grooming certain areas. And I feel like owners are really good at perceiving that. But suddenly we have a patch of ulcerness.
Thought, yeah.
Mhm. Those are things that, is it skin disease? Is it gut disease? Is there a tumor somewhere? It's not to scare people, but it's rather recognizing if something has suddenly changed. Again, there may be something bigger picture going on and it warrants investigation. And even the most thorough examination and lab work doesn't always yield clues that we have to get a really good history by interviewing our owner.
Yeah, for sure, for sure. And I think cats, sometimes people are just like, "Oh, cats are really easy. Cats are just over there. They're really self-sufficient. You don't have to take them out on walks. You don't, all these things." So I think sometimes we're just not paying as much attention to the cats.
Yeah, I 100% agree. But I will say my cat owners are the ones that come into me, which specialty medicine's so fun because I see the people that are super, super motivated and want to have an answer, where a lot of the times they're so in tune with their cats where the meow is a slightly different pitch. And suddenly we find out that we're in heart failure or something scary of that sort. And it's because they've established that psychic mind connection with their cat.
Yeah, nobody knows your pet better than you.
Exactly. You are the expert on the pet. I just look at numbers and boss you around.
Yeah. Well, you mentioned diarrhea a little bit, or pictures of poops. I feel like some people have also said that that's a myth. Like they just always have diarrhea. That's normal for them.
You know, fun personality trait, right? I'm gonna go ahead and tell everybody I have diarrhea all the time too. If anything, there's actually a really handy fecal score scale that I encourage my owners to look at called the Purina fecal score. So the food company has helped devise something that has been substantiated in research as far as, on a scale of 1 to 7, what does this poop look like? Where a 2 is that nice, healthy, stereotypical log that we think of. If something is looking soft or mushy or discolored, getting an idea of that stool description or contents is so helpful because really for me, I help differentiate, is this a small intestinal problem, a large intestinal problem, or a combination of the two? Pictures can really help. Is there blood or mucus? Does it seem like, oh my God, it's a fire hydrant and it's never going to stop? Or does it seem like a soft serve ice cream machine and there's a lot of it, but we go to the bathroom once or twice a day? All of those can suggest drastically different things.
Yeah. So the Purina poop scale, people can Google it. We could stick it in the show notes so people. And of course now everybody has a phone, so they're probably taking
Yep,
pictures.
they're going to email their vet tomorrow.
Is you're keeping a log, like we're talking about these logs of symptoms, that would be a great thing to be like, date, time, number, and then you don't have 50 pictures of poop.
You got it. And the nice thing about it too is it's standardized and we can say, well, your pet lives mostly at a 4. Let's try and aim for a 3 or a 2. That those baseline metrics, especially if another vet takes over your case or you end up moving and you have to find care somewhere, someone can look at that number and say, I know exactly what this means.
Yeah, absolutely. You also mentioned blood work and things not showing up on blood work. So I think a lot of times I'll send somebody to the vet and say, let's make sure we rule out something medical first. And then they come back and they're like, yeah, everything was fine. The blood work was fine. And then they're just prepared to be like, it's not medical. What do you think of that?
So I have taught a lot of veterinary students in my career to this point, and while I was doing my residency, I used to harp on students all the time. Just because it's normal doesn't mean it's normal. And that's something where a lot of the times I even talk to my referring veterinary community that low normal or high normal were just as significant as normal. And just because we're not getting that little color flag doesn't mean we rule out disease. Oftentimes, when we also do catch abnormalities on lab work, it's because something is starting to go wrong. The body is really good at compensating and hiding disease, and we will do anything in our power to prevent that from showing up. But once things start tipping out of balance, that's when you're going to get your big flagged red values on lab work. But again, I think it's a matter of talking to your veterinarian, giving that history, and also not being afraid to ask, well, this is on the lower end. Should we look a little further into it? And I really encourage my owners to ask those types of questions too, because to me, it's a lot more engaging. And I find that both parties really benefit from doing the due diligence of, well, we've investigated these avenues, we've talked about it. I'd rather be over thorough than make those sorts of assumptions where, a low normal in one animal may mean, well, it's not a big deal. It's a young puppy growing, but a low normal blood protein level may tell me there is catastrophic intestinal disease and this animal is at risk of throwing a blood clot.
Wow. And is this also why it's important to have some baseline blood work throughout their life so you can spot?
Absolutely. Absolutely. So keep in mind, I'm not a general practitioner. They have a much harder job than I do, in my opinion. But getting that baseline lab work, especially when we talk about a year or two down the road and suddenly your pet is hospitalized, I can't tell if your animal has chronic kidney disease or if this is just a punch to the kidney and we need to go on a vacation with some IV fluids to bounce back to what our baseline normal is.
Yeah.
And
Well, I
those
think
things.
people it's hard. Oh, I'm sorry. I think it's hard because blood tests are expensive, so if your pet is young and healthy, you might be tempted to skip them at your annual, but it's so important if you have all that data to track over the years, it gives a much better picture of their health.
You are an angel. You are just sitting on my soapbox with me, where really it's not always about the number, it's about the trends too. And I think a lot of people, again, look for the color change. Is it bad or is it not? And lab work is confusing, as is even for trained professionals. But really, the trajectory when I'm looking through years of data, those are things that can really make or break where we head with the case, especially if we just don't know what's going on with it.
Yeah. Yeah, really valuable data for your doctors later in their life. So think that I literally just got my, like, annual and my blood work and all that stuff too, and I know, again, I pay, like, a copay, and you're gonna have to pay all of it at the vet unless that insurance that covers it, but, it's good to let people know how valuable it can be down the road. Because I think some people think when a test comes back normal, it was a waste of money. Do you
Dude.
see that point of view? They're like, "Oh, I think it's very valuable if it comes back normal."
Oh, absolutely. And I think it's something that I joke with my owners. Hey, your pet's ultrasound's really boring. I don't get to tell a lot of people that, where normal is just as diagnostic as abnormal, in my opinion, because we are ruling out all these catastrophically awful things where, to me, boring is helpful. It does open up a can of worms as far as what do we have to take a closer look into. But it, I think people don't see the other side or those awful diseases that tag along with it is it doesn't rule out disease completely, but rather it allows us to rule out the worst case scenario immediately.
Yeah, absolutely. Let's talk about weight. They've always been skinny or they're not chunky, they're just well loved or they're cute that way or whatever they say.
Well, and I kind of joke that some of my patients are Rubenesque, right? Because, I don't like using the term obese because I think a lot of people feel ashamed when their pet is overweight or underfed. And a lot of the times I'm seeing animals that have some sort of reason as to why they're skinny. Their intestines or their pancreas have pooped out and they just can't compensate no matter how many calories we throw at them all day long. Whereas those animals that have become overweight or obese, there can be underlying endocrine disease. It can be that we are physically holding out for the more delectable things because we have trained our family to give us those things, but it's because it hurts when we eat something that we're normally offered, where an overweight or obese animal can absolutely have intestinal disease, just like the skinny one that looks emaciated. And then animals that do remain overweight or obese, we talk about all the dangers that exist in people, but more in the veterinary world, we are able to control what our pets get, and controlling their weight is one of those things that, in my opinion, is one of the easiest things to do. It is challenging getting a pet to lose weight, but because those things have been associated with respiratory disease or GI tract disease. A lot of overweight and obese cats are especially predisposed to type 2 diabetes, like we are in people too, which for some people, suddenly adding in an insulin regimen for their cat can be something that leads some people to make euthanasia decisions because they just can't accommodate it or it gets expensive. So, those are things where a nice, healthy weight is not to make anybody feel ashamed, but we use it as a metric to really evaluate, is this animal undernourished or overnourished? And do we have to ask why? And it may be something as simple as, well, they get a lot of treats, but again, is it because we're holding out for something? Or are we doing something like overproducing steroids because our adrenal glands have a little tumor on them? There's so many cans of worms. And the other thing that I encourage owners and veterinarians to do too is not just look at the body fat, but look at the muscling, because muscle is one of those things that takes a lot of energy to maintain. If suddenly we have some asymmetry or suddenly one leg is less muscular than the other, that can imply things like orthopedic disease or, again, autoimmune disease of the joints. Cancer can take away muscle. Heart disease can take away muscle, GI tract disease can take that away. So if we start feeling things like the rib and spine, and there's a really cool scale by the World Small Animal Veterinary Association called the Muscle Condition Score. It's not a numeric scale, but we look at an animal and say, hey, can we feel its ribs and spine really easily? And those are things that can clue you in a lot earlier than just losing body fat. You can absolutely have an obese animal with no muscle mass, and that can raise a lot of big flags.
Yeah, I was gonna ask you to talk about the body index score because, because there's so much differentiation between especially like mixed breed. Like my dogs are mutts, right? So there's no way to be like this is their ideal weight, this number. Potentially if you have a purebred dog, there might be a range where they say this is like the normal range for this dog, but even still, you have to look at each individual animal to know if they are at proper weight and um you touched on it with the musculature, but can you tell people about the body,
Yeah, there's a couple different body condition scale.
body conditions? There
Yep. It's a lot of words this late in the day, but there's also body condition scores. There's a lot that exist out there. You may see some that range from like a 0 to 5 or a 0 to 9. I joke that I like more numbers, so I like the 9 scale because it lets me be a little bit more particular, where we consider either a 3 or a 5, depending on the scale you use, is normal. And what I look for in an animal is, am I able to feel their ribs without having to go through a layer of fat? Am I able to easily palpate their spine? And is there good muscling around it? Because again, keep in mind, I'm looking at muscle mass, and do, depending on the breed, maybe have a nice hip tuck where it seems like their belly goes up to their pelvis and looks nice and neat and put together. Obviously, that's not going to apply to the French bulldog or English bulldog where they're built like a tank, or the sight bones bear. They're like the supermodels of the dog world, right?
Yeah, they're all different, and then you wanna look from above, right? That you wanna maybe again, except for the rotund ones that are built that way, that you wanna see a
Yeah.
waist, no matter
Exactly,
what, yeah.
exactly. And honestly, snapping a photo from a top and from the side too, especially as you're investigating diseases with your family vet, that progression can be helpful because we see our animals every day. I see a lot of animals where they have conditions where they do things like build up fluid within their belly. And I have my owners buy things like a tape measure and get measurements every other day or once a week to help us determine, are we making good progress without having to go to the vet's office and really determine what's going on, where we live in the day and age where we have photos, we have tools, we have email. We don't always have to stress our pets out to bring them into the hospital. And there's a lot we can do with simple images and communication.
That's awesome. There's one more myth, that you mentioned in your post that I wanna touch on. His breath is bad, but his teeth are fine.
Oh man, this is one of my favorite things of all time. And I think a lot of people truly under recognize it's this sexy category of disease called aerodigestive disease, which I always have to have my conspiracy map behind me when I explain this to owners, but is this proposed and recognized connection between the GI tract and the respiratory tract, where I tell a lot of my owners, well, if you know anybody who has GERD or heartburn, sometimes they wake up with a sore throat or a runny nose. Dogs and cats absolutely can have the same thing happen. And when we talk about aerodigestive disease, it is this proposed thought process that food is failing to go from point A to point B, so from the mouth down to the stomach, so an esophageal problem, or is it a GI problem where that is causing the stomach to get pissed off? The lower esophageal sphincter, that little valve that separates the esophagus from the stomach, gets loosey goosey, and suddenly they are silently refluxing material. A lot of people do not know the difference between vomiting, where I think we've all been there after a night out, the versus regurgitation, where it comes up like a baby. And animals will silently aspirate all the time. And it's really changed the paradigm on how we approach these animals that have things like a chronic cough or chronic nasal discharge, where that reflux is really caustic, irritating material. It can contain bits of food, and suddenly we have a snotty nose, or they'll make a cough that sounds like, which, we try antibiotics, we try steroids, nothing works. And then people come to me at their wits' end and I say, tee hee ha ha, just kidding, your dog has a food allergy. And they look at me like I'm a crack bottom. And suddenly a week or two after trying new food, they're like, oh my God. So,
So that sounds like a lot of things that it could be.
oh yeah.
How many GI specialists are there? Because I feel like this is a newish specialty, right?
Yeah. So internal medicine is the specialty that I chose. And in the United States, I want to say there's close to only 1,400 or 1,500 internists in the whole nation. because not a lot of veterinarians choose to do residency. You can go to practice right out of vet school, which again, GPs have a much harder job than I do. As far as specific gastroenterologists, there's not really an established discipline. I worked at a facility where we had experts in GI disease, so GI tract and the pancreas. So I kind of was gaslit into learning to love it. And now it's my favorite thing because the gut is a very quick and receptive organ for the most part. Um, I know that the American College of Veterinary Internal Medicine is now creating fellowships. So for those people that
Okay.
aren't tired like me, they can do another 2 years after a residency to specialize in gastroenterology is one that they're looking at. But honestly, a lot of what we know about dog and cat GI tracts, we also extrapolate a lot from human medicine too.
Yeah. I was going to say they're really only starting to really investigate the gut. So that's why I was thinking it was a new specialty because they haven't realized, not that they haven't realized it was important, but they just haven't studied it as much.
It's such a cool organ, and I think especially there's also that myth, like, veterinarians don't get a lot of training in nutrition, and there are board-certified nutritionists out there, so people who spend 4 years of their life literally studying pet nutrition. To me, it is such a cool area because we can truly treat food like medicine too, and that's something that is so intimately linked with gastrointestinal disease where I know enough to be dangerous, but a board of nutritionists, they are saints and angels with Excel spreadsheets where they can come up with just these little tinkers and things as simple as fiber content and make a world of difference in some animals with complicated GI tract disease. And I tell a lot of my owners to think of the GI more of existing on a spectrum where your cat doesn't just have IBD, your cat can have a component of food allergies at the same time too. And that's where sometimes we have to take these multi-prong approaches to manage an animal's symptoms overall. And that's again goes back to that point I made earlier on is really telling me what has or hasn't worked, even if it is a small improvement or no improvement, that can be so helpful for us to tinker.
So that's a great place to end because unfortunately we're out of time. But I do want to talk about what to bring to your vet to get the most out of the appointment. So you mentioned the log and you just mentioned it again. And what kinds of things do you think are pertinent to put in that log? And what other things can people bring to get the most out of this time at the vet, at the specialist?
So, especially at the specialist family vets, they may not have all the time in their day to look at those minutia, but honestly, logs and patterns, if you can just write that down, even with the date, you don't have to give me scores or numbers or anything. It helps me get an idea of frequency. Photos and videos, I cannot reiterate that enough, how drastically those can change our investigation, or even showing me something similar online to say, hey, he's doing something like this. And then probably the most important thing on my end is the medical records, which vet offices tend to be pretty good about it. But if you have your own copy or log, or you've seen a couple different veterinarians, those are things that are so, so, so helpful for us to not only compile all this for a medical record, but come up with the best game plan and the best use of somebody's resources to figure out what's wrong with their pet.
Yeah, absolutely. Thank you so much. I learned so much today. Thanks for all.
I'm glad. Of course. Thank you for being so excited about this. And I'm certainly happy. I usually answer DMs on Instagram and TikTok. Sometimes I can be a little slow because I'm a busy guy, but I love just being able to help people and act as somebody who can help navigate these things because owning a pet is really hard. It is a long obligation. And I'm just excited there's people like you that are advocating for but why is this happening?
Yeah, absolutely. Thank you so much.
Of course. I really appreciate your time.
Thank you for listening to the Enlightened Pet Behavior Podcast. I hope you and your beloved pets have found valuable insights for a more harmonious life together. Please remember that this podcast provides educational information only and is not a substitute for professional veterinary or behavioral advice. If you need personalized support, please don't hesitate to contact me and we can explore how we can work together to achieve your pet behavior goals. You can reach me at enlightenedpetbehavior.com or via email at susan@enlightenedpetbehavior.com. This episode was edited by Monty Light. Special thanks to Mac Light for composing the podcast's music. You can find him at maclightsongwriter.com. Treasure those fur babies, and I'll talk to you next time.